Alrighty.
We're on.
We're on.
We're recording. Hey, how's it going? Welcome back to another unofficial episode of Finally Famous. And today's topic is whether or not shockwave therapy actually works for plantar fasciitis. And so, Dr. Donald, we have our lovely foot model here. We won't reveal who it actually is. It's someone who's been in the chair quite often for different ailments, this time around for plantar fasciitis. And so the answer to the question is yes, shockwave therapy does work for plantar fasciitis. Once you're officially diagnosed accurately, which is always the first thing that you should intend to do if you intend on having shockwave therapy. Shockwave therapy represents a non-surgical option to actually heal your plantar fasciitis, which in a lot of people's cases and a lot of people's desires is to not have surgery, but still, of course, become pain-free. And this is a great way to do it. It's not covered by insurance, but if you're looking at the overall cost, the cost of shockwave therapy treatment typically winds up being less than the cost of your actual medical treatments via insurance, because of the frequency and the pace at which shockwave therapy actually helps to accelerate the healing. And so basically you have the actual handle right here, and there are different pieces that go on the front here depending on how you're trying to channel the energy. And of course we keep it covered. The machine in our case is actually located inside of the bear, as we like to call this here. And we need a conduit so that we can have these shock waves transferred into the actual foot here. And essentially what happens, we're going to turn this on. Is dependent on, the severity of the actual injury, which is usually diagnosed clinically as well as with imaging, x-rays, as well as MRIs. We use the shock wave and we turn it on. This is pretty loud. And it's typically suitable for the patient because we can modify how much pressure we actually place and how much energy we actually push into the actual foot. And so we use this along with an actual strategy for so many times a week or so many sessions all total, depending on the acuity of the actual issue. And this helps to accelerate the healing by causing tissue remodeling in the area, as well as improvement of the vascularity in the area. And in cases where the bone is actually injured as well, it helps to heal bone injuries also. And of course, when we talk about tissues, we're talking about the plantar fascia tissues primarily, but we're also talking about the other soft tissues that are around that plantar fascia. Those are also positively affected by the shockwave. No side effects to it, and generally speaking, patients walk out of the office feeling the difference immediately. That is, it's a cumulative effect overall. So there are multiple treatments, and yes, it does work. It does work pretty well. And we're going to get started with this session. So while we're doing this, you guys have a great day. Thanks. Bye-bye. How did I sound?